Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, welcome back to Research Perch. I'm Michael Reynolds from the Massage Therapy Foundation's Marketing Committee. Glad you joined us today. Research Perch, as you know, if you've joined us before, is where we unpack articles from the IJTMB, which is the International Journal of Therapeutic Massage and Bodywork, and bring them to life to you, our audience. So thanks for listening. So here, as always, with Ruth Werner and Nikki Monk. Ruth, how are you?
I'm great, Michael. How are you?
Doing well. Nikki, how's your day going?
Doing fantastic. Thanks, Michael.
Good. Glad to see you're well hydrated. Got your water there. That's good. So.
Indeed.
My coffee.
Indeed. All right. So again, thanks so much for joining us, whether you're watching or listening. We're thrilled to have you here. So if you're just now joining us, again, we reference articles from the International Journal of Therapeutic Massage and Bodywork, which is at ijtmb.org, and we discuss one article per episode to help you kind of unpack it. So if you're a longtime listener, welcome back. Thrilled to have you back. So today we are talking about concussion treatment using massage techniques, and this is a case study, and this is from Sylvia Burns. Mm-hmm. So this obviously is found on the ijtmb.org website, so we encourage you to download the article and take a look at it. If you search for concussion treatment in the search bar, it should pop right up. Go ahead and download that. But let's go ahead and kind of jump into what's going on here. So Ruth, I believe you wanted to start today, right? Were you going to tell us a little bit about post-concussion syndrome?
Sure, I can take us a little bit through that information. So this is a paper about a client who had a condition called post-concussion syndrome, and I'll just give a really brief description of that, and she does quite a nice job with it here in her introduction. So a concussion is a type of traumatic brain injury where, because of a blow, the brain hits part of the inside of the cranium, and there could be some bruising or some inflammation. That might take some time to resolve. And what happens for some people is that even after those symptoms resolve, even after the physiologic changes resolve, so the swelling goes down or the bruising subsides, some symptoms are prolonged, and those symptoms include things like vertigo or dizziness, and really bad headaches, and problems with balance, and problems with focus and concentration, sometimes visual changes, sometimes auditory things, weird auditory things can happen. And this thing called post-concussion syndrome can really, really mess up, your quality of life, and it can be hard to predict who's most vulnerable. It is definitely a factor when people have multiple small head injuries, like in a short period of time. So this is a big reason. I don't know if you follow the NFL at all. This was responsible for a huge change in NFL rules about testing players for concussion after they've been injured on the field, and they cannot get back on the field until they've been absolutely cleared, because we find that with multiple small injuries, the amount of damage that accrues gets worse and worse and worse. And at the very, very extreme end of it, there's a whole encephalopathy that can happen with multiple head injuries, and that's not the topic of this paper. But I want to point out that this kind of brain injury is a big deal. The client at the center of this study, according to what's reported, had only one episode where he fell and hit his head against a bench. We don't know, and he may not even ever have associated it, if there had been any previous injuries, that could sort of go on top of. But what I can tell our listeners is that these brain injuries can be very, very tricky and really hard to deal with.
Okay.
They're not only, and we see them in increasing numbers in the United States for a number of reasons. They're associated with, sports injuries and motor vehicle accidents and things too. But of course, this is the type of injury that we're seeing in massive numbers among our returning military. In previous wars, people with head injuries on the battlefield just didn't make it. So we didn't have a big population of people to sort of study who were survivors of head injuries, and we're learning a lot in the hardest possible way.
Yeah, I'm kind of struck by the significance of this case study because of the reasons you mentioned. Sports injuries, military, I mean, this is obviously very widespread. So the significance of this case study is interesting to me.
Well, and something to keep in mind too is that the two biggest populations of mild brain injury like this are going to be your pediatrics, children, and your older adults. And so while this is not the population that this particular case study was looking at, this is a 23-year-old healthy graduate student, and he was playing soccer and had this happen.
Right, but Nikki's right. For the mild end of traumatic brain injury, the two main populations are toddlers who are literally toddling.
I followed a lot.
Yeah, as you will soon learn, and elders who are at risk for balance problems. That can then be, of course, made much worse with mild brain injuries.
Right.
So it looks like there were 2 sessions of 45 minutes, correct? 2 days apart was the treatment?
Yes. Yes. So let's talk about the actual case itself, and we'll go ahead and set this up.
Yeah, I'm curious about the treatment. Yeah, go ahead, Nikki.
So the first thing to point out here is that this is an excellent example of a case study. And what I mean by this is it's a very rich, descriptive report, if you will, about something that happened in practice. She points out in the beginning that this is a retrospective. In other words, she was looking back on a case that was really interesting to her. And I'd also like to point out that this paper started as a poster at an AMTA convention. So it wasn't to my knowledge, it wasn't submitted as a case report contest or anything like that. She just did it as a poster. It's of great significance, and one of the reasons it's so significant and so very interesting is that she in detail talks about her approach, and she does it in such a way by laying out the rationale for it. She says what she did in what order and why, and she also highlights and points out the fact that she's a very extra educated practitioner. She's gone and done a lot of continuing education specifically for these things. She also works in an environment where physicians are referring to her, particularly for these sorts of episodes. And so she was known to the general practitioner who saw this young man. He had the injury. The next day he woke up. He had a terrible headache and was having other sorts of issues. He went to the GP. He did some treatment with him. A month went by.
For headache and dizziness and didn't get relief, right?
Right, and a month went by. He's continued to have issues. He went back to the GP, so just sort of usual standard care for mild concussion like this. And he still wasn't getting relief, so the GP said, okay, go and have massage. So he actually referred massage therapy, and knowing Ms. Burns's work, sent him to her. So she does a really great job of documenting this progression of him and his case until it got to her door. Once it got to her door, she decided that she was going to treat him twice, and 2 45-minute sessions, and with very little time in between, so 2 days in between, and then she was going to do a week later do a follow-up. And so this is just something that she does in her practice. So she didn't purposely design this case report, if you will. This was standard care for her. And then she lays out in detail the techniques that she used, and she also talks about what she hypothesized was happening in her, and she talks about that she felt that there was a subluxation. Am I saying that correctly, Ruth?
That's correct.
Okay,
yeah,
subluxation.
At the atlanto-occipital joint.
Right, and so she doesn't, of course, and this is usually something that's addressed by chiropractic procedures. She's not a chiropractor, and so what she's suggesting is that she's approaching it through soft tissue maneuvers and soft tissue massage, and she goes through great detail of this and really highlights the fact that she's been extra trained in these special palpation measures. But she talks about it from not only this is the conceptual model of my treatment approach, but then she took a step by step. She did this piece, she felt this, and this is why she made this next treatment choice.
Nikki, before we go on, because I really want to talk about sort of the way that she reported that, because it's a great example for other people to use. But this is described as a case study. That's the title, right? Concussion treatment using massage techniques, a case study. As a seasoned researcher and someone better educated in this than I am, can you talk about differences between case studies and case reports?
So
Is there a technical difference?
Well, this is one of the things that I've avoided talking about in our research perches, but I think that it's time to actually talk about it. And case studies, there's very slight nuance, okay? And case studies is a really rich, descriptive discussion report on a particular case. A case can be a patient, a case can be a series of patients, or a population, or implementing something into practice. It's really closely, critically looking at it, but not doing anything outside of just observation and what usually happens. A case report typically is when you have some sort of, you're actually going to be implementing something perhaps that, not necessarily an experimental case design, because that's
right. That's case report.
That's definitely case report, is when you have like an experimental case design. Okay, that would be a case study, or excuse me, a case report. But if you were to really simplify it, and I've heard it simplified this way, a case study is more qualitative in nature.
Okay.
While it may have numbers associated with it, it's not the same sort of this amount of change quantified specifically by this particular number. Whereas a case report, you're looking at the kinds of measures and you're discussing it in such a way that really looks at that quantification of very specific numbers, outcomes, and the like. So this is a case study, a very rich qualitative description of what was happening and the rationale behind that, and just sort of a study, if you will, of what occurred.
Right. It's the story of here's the story of a massage therapist. The story of what happened with this massage therapist and her client, and she had
implications of it.
To be able to do some follow-up with him, which was really great. This helps me a lot, that case studies may put more emphasis on qualitative, descriptive reporting, where case reports we look for quantifiable numerical kinds of measurements. Certainly for the Foundation's case report guidelines and contests, that's something that we look for. But I do want to emphasize that in case reports, while a person might be trying something new, it's not an experiment in that it's outside the realm of what they would normally do. Possibly the only difference between between what Ms. Burns did and what anyone else similarly trained did in preparing this was to gather all the background data on, the impact of post-concussion syndrome and why it's important to document what massage therapy can do in context.
She really did a superb job from the beginning of really highlighting and putting into context the case, why it's important, and the like. Really nice job. And then in the end too, she talks about the implications of it, and she doesn't overstate the outcomes. He had great results. And she and he both attribute those results to the treatments, to those 2 45-minute treatments that he had, and was looking not only at some very specific measures such as the visual analog scales and an 11-point scale measure, but also looking at some specific balance measures and his ability to do those things.
She had a balance board thing for him standing on, right?
No, he just did a close-eyed and stood up.
Oh, right. It was not a board. It was just how many errors he made within a period of time, right?
Yes. So it's a standard, real simple measure that you don't have to necessarily have any kind of materials or equipment for.
Well, it's funny you mentioned the outcome. I was excited to see the outcome because it seems positive, and you mentioned not overstating the results, and I think I'm obviously no researcher, but I've learned enough from the two of you to kind of see that it's always very conservative when you see the outcome. It's like positive results highlight potential importance. It's like very, very safe conservative language, but I know enough to read that and say, oh, well, that's a good sign.
This was one person and one situation, and this is also a very detailed discussion of how she did it and why, right? And it really does a great job of saying, in this situation, it really helped this gentleman.
Yeah, that's exciting. That seems very encouraging.
More specific actual research ought to be designed that's using massage therapy in these sorts of things to see if these results can be replicated.
Well, with a group of a population that large. I mean, think of how many athletes and military
Football players
personnel.
are there. Yeah.
I'm sorry?
How many high school football players are there
Yeah.
who are
It's huge.
getting-
I mean, this has massive implications, and if massage therapy can have a positive impact on the recovery of these individuals, that's pretty significant.
Yeah.
That's great. I'd love to see more research on this.
I would too.
Oh, yeah.
Absolutely.
Let's can we talk a little bit about, because Nikki, I know you were involved. You were one of her editors, and so you helped her, shape this article and shape the way she presented her information. And I just would love to draw readers' attention when you it's not if, it's when you download this to look at. Do take. I'm not a person who really loves tables. Everybody who works with me knows that. I don't do tables very well, but I actually did these tables because she, for instance, she looked at she created one table of the interventions that she chose, and then she for her tools and assessments,
Yeah. Mm-hmm.
right? And then she listed what the tool and assessment was, and then how it was done, and then what her rationale was for gathering that particular piece of information. And then in her physical techniques chart, she has a heading for position location. She has a heading for what the technique was for that location, for what her objective was for that location, and what her rationale was for why she chose to do that. And I think probably there are people who could question her rationale. There are people who could question her foundational principles. It's the paradigm on which we build our worldview of how massage works, and so that's how she goes forward. And and that's great. But she framed her reporting in such a way that you really could look at every decision that she made and put it in the context of her goal. And I would love to see, as someone who reads a lot of case reports through our contest, I would love to see more people, try to institute this kind of careful reporting of what they do. It's always a very difficult part of a paper to write the methods section.
It is.
You don't know how much information to give or hold back, or is it too long, is it too short?
Well,
If you download one article, download this one. Is that what you're saying, Ruth?
That's there's a couple of really great, but this is an awfully good one.
This is one of them. Yeah. Okay.
Yeah, it really speaks to the question and a problem that we face as writers as how to best present information. And when we're trying to present information that is reflective of how we practice as practitioners, and this was something that was particularly challenging. And so this is something that I don't think she'd mind me pointing out. This was a 2-year writing process with how to put this information together, and so that it wasn't that it was very reflective of what she did, but then organized in such a way that it wasn't just sort of stream of consciousness writing, right? And so being able to put this together. So, as Ruth said, you're able to clearly see it, and while she expands on it in the text, she doesn't repeat what's in the table. She lets the table stand for itself, and then she fills in with her text, which is something from a writing perspective is really, really important, and so really nicely done in this regard. I think it was 2 years very well spent, and that was also with life included and things like that. But really nicely done. And then she did the same thing with the results. She presented a really nice results table that said, here are the areas of concern. And so these are the things that our clients come and tell us. These are their troubles. I have headaches. I have a focus and concentration trouble. I'm on all these medications. Here's my pain. And then the pre-treatment, what it was for each of those things, and post-treatment. So here again, it's a rich description. It's not the quantitative table that you're going to see with other research. This is something very appropriate for a case study and a discussion of what happened in her practice. Very well organized.
So two great takeaways then. One, obviously, is the content. Our listeners should absolutely download the article and get familiar with the content and what really happened in the outcome and the process here and how it did affect post-concussion syndrome, but also a good example of a case study. So for those who might want to get into research,
yes.
Sounds like it's a great example of how you might model your approach. So that's really another great takeaway I'm hearing from this. So
So real quickly, let's talk about what the results were.
Oh, I thought we did. I'm sorry. Is there more?
So basically, he had constant headaches after his 2 days of after his 2 treatment sessions. It went down to 0. He could only focus for about 15 minutes before the treatment started, and after the 2 treatments, 2 hours or more, and that continued to get better.
Wow.
She had a couple of impromptu follow-ups that weren't scheduled. He just came in like 6 months later and then a year later and said everything was doing great.
I was still, a patient at that clinic for some other things. So.
Right. So he had uneven postural balance, and he was balanced by the end of it. We get to see his scores improved greatly. And one of the important pieces too about this, and this is for him, is that he was able to finish his master's thesis. And this is really significant because his post-concussion issues were really hindering him from doing that because he had to go and collect data in the water. He was in a boat. And he couldn't even he couldn't move his head down, and he kept getting nauseous every time he got in the boat. And so it was hindering his education. And so after these sessions, he was able to go back, get back into his life, continue his studies, and he finished his thesis.
That's fantastic. That's such a great story to hear.
Operating trucks and fishing boats, performing fitness activities of soccer and running, social activities of viewing movies and playing cards, handling his work on computer screens, all as he had done, prior to his head trauma, and how much of that is sort of the natural history of what happens when we heal, and how much of that is because of these 2, relatively short sessions. It's got to be a combination of those things, and the fact that he's 23 years old and a vital.
Well, in great shape, obviously, yeah.
But I think the important piece here is that he had no change. It was just getting worse for a whole month before he saw her for a grand total of 3 days. Right? Came 1 day, 2 days off. 1 more session, and these were the outcomes.
Well, isn't it nice when you see a very clear positive recovery in someone like this, and you know that, or you see some evidence that massage therapy may have played a part.
So, you had a piece of that, right?
Yeah, that's really nice. What a feel-good story this is.
It is.
It is. I really appreciate, and I really want to commend Sylvia for her reporting this, bringing it up, and then sticking to it and getting this out into the literature. It's an important contribution, and I'm really proud of her for getting this completed.
Awesome. Well, thank you very much to both of you. And this is obviously a great one to, like I said, if you're going to download one article the entire time you listen to Research Purge, hopefully you'll download more. But if you download one, this is a good one. So, so that's great. So, anything else before we wrap up?
Yes.
Yes. Okay.
It's a retrospective report. That means she wrote it 2 years, 3 years, 4 years after this had happened, based on her record keeping.
Yes.
Means some really important things, which is that you listeners can write reports on cases that have already concluded if you take really great notes on what you do. And so, I think it's a great goal to begin every therapeutic relationship as though someday you might want to write a case study on it, so that we get in the habit of taking these fantastic notes. And I really invite all our listeners to go back over some of the really remarkable things that you happen. Everybody has 1 or 2 stories of the ankle that seemed to get better so quickly, or the head injury, or the back pain, or whatever. And evaluate what you're doing with your charting to see if you're ready to step up to something like this, because I think that's a great goal for massage therapists.
And it's very important for our field. So until this was published, this just added to the anecdotal evidence for our field. This is published now, and if a physician were to go in and do a quick PubMed search for massage and concussion, this article is going to come up, and it's going to show how this woman very clearly documented a massage approach to this that might have a physician be inclined to say, you know what, nothing seems to be helping you. Let's see if we can find you a skilled practitioner.
And in fact, I did that exact thing today, Nikki. I went to PubMed and did a search for massage and concussion, and there wasn't very much that came up, but this was at the top of the list.
Yep, there you go. And Beautiful. This is why case reports and case studies and getting them published in peer-reviewed journals are so important. It's great and fine to submit it for a class or for among your peers or to talk about it, but if it's not seen, then it's not seen.
Right.
Well, I want to leave our listeners with another takeaway, since we've kind of focused a little bit more than usual on kind of the structure and the importance of maybe getting involved in research and doing things like this. So I do want to point out that we do have an ebook authored by our very own Ruth Werner here on the Massage Therapy Foundation website, which is free. It's called How to Connect with a Researcher. And if you go to the massagetherapyfoundation.org website and click on resources, I believe it's the first one listed. So we encourage our listeners to go download that ebook, which is free again by Ruth, and it'll help you learn about the process of connecting with a researcher and getting involved, and maybe becoming a part of this this grand community of researchers. So I want to point that out. So.
Well, and it's not too early. Right now, we're recording this in July of 2015. But it's not too early to think about your calendars for the third week in May of 2016 will be the next International Massage Therapy Research Conference in Seattle. And so, start gathering your information, gathering your data, think about if you want to submit a poster or a project about this, and we'll
perhaps just come for the first time and
Absolutely.
Go and see the research conference, and then
hang out with the researcher.
Hang out.
Mm-hmm.
All
the
right.
next time do a submission. Yeah, absolutely.
Beautiful.
There's continuing education credits there too.
Oh,
I love this story. The one we talked about today was great. So thank you both so much for sharing your insights. And again, for our listeners, please go download it. It's linked below the blog post. If you're listening and you're not looking online right now, just go to ijtmb.org, search for concussion treatment, and it should pop right up. You should be able to grab the article right there and download it. So, Ruth, Nikki, thank you so much, as always, today. Real pleasure, as usual. And to our listeners and viewers, thanks so much for joining us. Again, this is from the Massage Therapy Foundation, so that's at massagetherapyfoundation.org. You can subscribe to our blog there and get more content like this. So we appreciate everyone for joining us today. So Ruth, Nikki, have a great day, and thanks, everyone. We'll see you next time.
Bye. See you next time.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.